So welcome everyone. We've heard a lot about AI today and probably also in the last couple of weeks and couple of months. But today I want to make it a little bit more practical by talking about how can we actually use this in health infrastructure, especially in terms of reducing risk. So let's start with a quick intro about myself. So I'm representing Siemens here today. I'm responsible for our software business in Australia and New Zealand. But I'm also a certified breathwork instructor. It's nighttime basically, so that's my second hat that I'm wearing. So if you ever have issues with topics like sleep, focus, might be a topic today for some of you, and also just working together in teams. Feel free to follow along on LinkedIn. I'm usually sharing some practical tips around that. Now, this morning we've heard by Jono about some of the challenges that we are all facing in the healthcare industry. And the most critical issue that we're having is we're having on the one side that pressure for performance. And on the other side, we have risk, right? So there are a couple of fields that you might all relate to. Is anyone in the room who can't relate to at least one of these areas? Please raise your hand, because I would be surprised. Yeah. All of us somehow get involved with some of that fields. It starts obviously with patient experience, right? It starts with making sure that the patients feel well when they come into the building and that they have the best experience in the hospital possible and obviously get healed. But then there's also the topic of staff productivity. There's a topic of sustainability. How can I operate more efficiently? The whole topic of cybersecurity has become a bigger and bigger issue. And then we have staff aggressions and the constraints in terms of construction costs. So it's all there. And then at the same time, there's this evolution happening, technology evolution, and we have a lot of different buildings. On a healthcare campus, we might have some of those buildings that are very traditional. Yeah, some buildings might have some sort of automation, and the newest buildings would be what we probably call smart buildings. But we're reaching an area now where we're talking about autonomous buildings. To be precise, human-centric autonomous buildings, because the human is and will always be at the center of the buildings, right? This is what we're doing. We're spending most of our time actually in buildings. And especially in the healthcare field, what we're trying to do in this next evolution, we're trying to make use of all the data that is available and making a few things a little bit easier. And I have a practical example today that I want to talk about, where the customer has solved some of these issues here. So the reality is we have fragmented systems, right? We have bad data. We really have a lot of reactive maintenance. A lot of stuff is happening paper-based. That's the reality, right? I'm trying to sell you some software here that sounds super fancy. The reality is different, and we're aware of that. There are a lot of operational disruptions happening every day. We have limited capacity in terms of staff, but also time to even deal with all these new systems. But one of our customers, which is a Melbourne hospital, has, started their journey with us about 3 years ago. And what we've done there is over time, and it's not a one day to another thing, we've established what we call a digital twin of a building. And as you can see on the right side, there are a couple of modules involved in that, right? It all starts with bringing different systems together. So we've heard about asset management and work order management systems before. Yeah, so that's brought in together into one platform. We have our building management system where we have real-time data coming from our field devices. We have obviously issue management. We have security staff that is being called all the time. But then also we have hundreds of documents. Yeah, some of them might be maintenance protocols, some of them might be technical data sheets. It's all sitting somewhere, usually on some SharePoints and some Excel spreadsheets, and that's obviously a big, big pain. And then how the operation is going on in terms of asset management and what is being done, it's very paper-based and manual. That was the reality with this particular hospital as well. And if you look at the data down there, 90% time reduction. Yeah, this sounds crazy, too good to be true. But the reality is, what happened is they really had people going around with pen and paper and recording the condition of their assets. Yeah, that would then be scanned in the office, upload it into one system, then hand it over to a different department who would then upload the same document to another system. And this is, as you can imagine, if you digitalize that whole project process end to end, where it's being uploaded once, it's actually digitally captured on an iPad in a digital form. You can take a photo, all the annotations are fed into one system that then pushes the data, your maintenance protocol, your asset condition report into all the systems at the same time. You can imagine how those 90% time saving actually occur. One FTE. So that doesn't mean that FTE was actually made redundant. That means that actually the staff that already is under pressure and will be even more in the future. I've talked to a few of you yesterday, and everybody's saying the same thing. There's staff shortage, right? That's the reality. Either there's no budget for new staff, or you just clearly can't find the young people coming in and with the willingness to work in our industry. So that's an issue. So what you need to do is you have to try to take some load off those people and make it easier to do the same amount of work or even more work with the same number of people. And at the end of the day, you have that single pane of glass, right? That's how it looked like at this particular customer. Now, a little bit of a recap of what a digital twin is, because some of you might be asking, okay, that sounds all cool, but what are you talking about? What's a digital twin? So this is a typical construction project. What's happening is we have a design phase where we have information that are being enriched, the consultant comes in, different parties come in, then all those information as a package is handed over to construction. What happens? We lose information. And this is what you can see there on the left side, on the y-axis, we lose information. There's a handover, but we always lose some information. Over the construction, this is all being enriched again. We have more and more documents, commission statements, commission protocols, we got technical data sheets, we got all coming together, photos and all the rest. Again, handed over to operations, to the facility management team. What happens? We lose information. They never get the whole picture. With what we call BIM-based projects, that's building information modeling, we don't have these gaps anymore because that project is handed over from design to construction to operations in one file, and that file is being enriched with basically a model in the front end, which is a 3D representation, and a lot of data in the back end. This is something that has been happening in the industry for some time, and most modern project would use BIM. But what we're doing with a digital twin, with an operational twin, is we're actually trying to enrich the information. So we're making the twin even more intelligent. We're making the information more available to everyone in the building. So as you can see, in the handover phase, especially from the design construction to operations, we're getting more information. And this is basically the integration of real-time data. So all your data from your building management systems, from your fire systems, from your security system, that's all data that is there, but has been siloed until you actually realize it in a digital twin project. Now, on another project, we've used the digital twin actually in the design construction phase, and just to show you what it means if you don't have that loss of info in the handover, at 26%, so nearly a quarter of the time was reduced in terms of labor during the commissioning phase because of a digital end-to-end process where the technicians have used that platform, have uploaded all their protocols, associated them with the assets, and the FM team could then actually use it in operations, and they don't have to look into 5 different SharePoints to find what they need if anything breaks down, right? If there is reactive maintenance or any sort of predictive maintenance, and we'll come to that in a minute. Now, end-to-end, again, we have everything covered. Ideally, with the BIM, we have this ideal world of project information transferred to the operational team, asset information, operation manuals, and then sensor readings, all your predictive maintenance enabled by AI. AR sounds fantastic, doesn't it? Yeah, it sounds too good to be true. That's the reality. That's also the reality. So we're having a lot of different systems. We're having a lot of different screens, and most of us, and that's not only in the private world, but also in the business world, and some of you might relate to it. Who of you have that situation? Who of you have seen that situation? Please raise your hand if you've seen this before. Yeah, a couple of people in the room. Yeah, maybe a third or so. So this is something that is happening. And now think about all your apps that you have on your phone, yeah, which are representations of different dashboards as well, and all the different things you can do. What has happened when ChatGPT, Claude and all the rest got released? What happened? You have one app. You have one app that gives you all the answers. And this is exactly what we are also doing. So for the facility management teams, for the asset management teams, we've come up with basically your AI support, which helps you to answer all your questions in terms of your role. And let's talk about some very practical examples of how that helps in asset management and facility management. So I mentioned hundreds of different documents. Yeah, hundreds of different documents, different SharePoints. Some of them might be even locally stored. So we've created what we call document agent, and this document agent can very easily, with one query, tell you, okay, the information that you need is, in this particular case, what sensors you need for humidity for that asset. It's sensor whatever, EE211, and then it gives you the technical documentation. It gives you a screenshot of the exact page and a reference where you can actually then look into that document. So you can imagine how much time you save rather than going through all your different locations where this could potentially be stored. You get this specific information right away. And that's also connected to your very specific asset. Now the next one could be something in terms of energy efficiency and consumption. So that's one of the critical areas that everybody's looking at, not only from a sustainability perspective, but also obviously to reduce cost at the end of the day. How can we reduce costs? You've heard about all of that before. Transparency, the data needs to be fed into some system that creates a high-level overview in the first place. That can be data that is coming from the BMS, right? It can be data that is coming from different sources. There are ways to connect legacy systems to a cloud. It's all possible. Don't have to talk about that. But this is the interesting part. The analysis that can now happen in the cloud by using AI is the following. First one, obviously forecasting. So the system can understand how the building is being used. Yeah? What's the occupancy over time? What's the actual weather conditions? How does the weather here on the Gold Coast impact a hospital versus a hospital in Victoria? That would be very different, right? So all those trends, the historic data, the weather conditions are considered here to create your forecasting, which makes it much, much easier to understand, okay, where am I standing in comparison to my energy budget? But the other one is also in terms of energy savings, something that is called anomaly detection. So there are patterns, and some of these patterns, if you have a really experienced engineer, maybe a data scientist who has worked on a particular building for many years, this person would 100% recognize these patterns, just by looking at it straight away. But the reality is, those people are rare, first of all. Those people will also leave your organization at some point. And again, if you think about the new generation of people who are very junior, they wouldn't be able to see that straight away. So this is, again, an opportunity to get an expert, to get an assistance with an automated anomaly detection that raises an issue. In that case, for example, if a meter has reached a certain threshold over a weekend period where it usually shouldn't have been that high in terms of energy consumption, it would flag that. And then you can do all the rest, as you can imagine, create an automated work order, transfer it to your CMMS. That could be any third-party systems with open APIs, and the openness nowadays, that's all possible. But just to show you, these are real examples, that are possible today. And then in terms of operational issues, and coming back to that topic of risk, what we don't want is a critical system breaking down, right? And how can we prevent that is obviously if we have the information readily available, and if that information is being triggered by the rule, for example, that has been previously set up. Yeah, so there are a lot of people that have worked on a rules library. In our particular case, it's a rules library of roughly 600 rules. But there are also people in your organization that might have that knowledge to create their own rules because they have that understanding of their site much better than we might have. Right. So again, how it works: data is being analyzed over time, trends are being captured. Some of you might understand it, most of you probably not. There's some German terms on there. What it just says, it's different temperatures, right, that are considered here, as well as the humidity. And in this red section, or looks a little bit like red, this is where the fault has been detected. And down below you see 53 occurrences, which is this particular fault has been detected 53 times over the last 9 days and 2 hours. These metrics will help you as a facility manager to understand, okay, there's something wrong with this system. And while maybe your asset management system tells you, okay, there's still some lifetime, this is actually not true. This is going to break down very soon, right? And you have to do something about it. And in particular, it would be amazing if it told you, okay, this is with a high likelihood the root cause of that problem, and this is what we would recommend to do. Right? This is something that would then really assist you. Again, if you think about that working day of a facility manager that comes in, uses this AI chatbot to ask, okay, what are my top priorities today? It will bring up this particular plant, for example, because it knows, okay, that's your highest priority today, look into that. And this is how it could look like, right? This is how it could look like. So as you can see there on the top, straight away, you start your working day, HVAC system, there's a failure detected. This is the equipment. Click on it, you'll get all the data, all your trends right away. You can run the triage to identify the root cause of that problem. Probably there has been already a work order created for that particular case. Maybe someone is already working on it, but at least you got the awareness straight away. Energy savings. While you have been sleeping at home, hopefully got some restful sleep in, the system has actually tried to optimize the energy consumption right there. And obviously, if you look at some operational theaters, etc., we wouldn't look at that. But if you look at some non-critical areas in the hospital environment, those savings could actually mean quite a bit of costs in the course of the year. And then in terms of energy peak, and this is an issue that is becoming more and more prevalent in the times of AI and data centers. Yeah, we're reaching a moment in time where energy is really a big problem. And this whole topic of energy peaks will become more and more of a problem. And most sites have some sort of data center as well. So this could be an issue as well that AI can help to resolve, because it will help you to manage those peaks more effectively. So you get this amazing expert that is available 24/7, that does some work while you're sleeping, that assists you, and especially, again, in times of staff shortage and budgetary constraints, and, just the fact that people are not really coming into this industry and studying what we've been studying, this can be a game changer. So wrapping it all up and coming to that whole topic of how does that help me with risk management, there are a couple of things that I can do if I have great data, starting from that whole moment of planning, making it something that can be handed over without losing information in terms of construction. So all your project management commissioning should ideally be end-to-end digital. The more data I create during that period, the better it will help me during my operations. My work order management, asset management, analytics, all kinds of stuff. And then the final phase, when we talk about renovation, you can imagine how much it will help you to then also improve how your next iteration of your hospital, that could be an extension, is designed. It's not only focused on obviously low cost. Then that's an issue that we have. Mostly we're looking at the low cost, but within our budgetary constraints, based on the data that we've captured over time as for our hospital, what would be an ideally designed hospital for my use case? And you can simulate that. So AI is also able to simulate patient flows in there. It's able to simulate how an HVAC system is working. It's able to simulate how the energy grids are working, and all the rest. Right? This is all possible once the data is there, and this is all handed over. So yeah, digital twin plus AI, for me, I think the equation is pretty clear. It means resilience. It really helps you to become more resilient, become ready for the future. And if you have no clue how to start with, I'm always happy to chat. So feel free to connect with me on LinkedIn, or have a chat with me during the lunch break. And with that, yeah, I'm coming to an end. I'm not sure if we still have time for questions. Otherwise, yeah, thank you.